So now, doctor, let's talk about gummy smile and how do you treat it? You have a procedure called lip lowering. So tell us about that.
Right. Again, keep in mind a gummy smile, when the lip goes too far up, what we call a hypermobile lip, and showing excessive amount of the gum tissue, it doesn't look good. So again, one of the elements, formation of total smile, is appropriate position or posture of the upper lip. And now the traditional treatment, when you have a gummy smile, that means shows excessive amount of gum tissue. The lip goes too far up. The traditional treatment makes it be what we call orthognathic surgery. They have to cut the jawbone and move the whole segment up. Extremely invasive. Nobody wants to go through it. Long recovery. They have to actually ligate or fix the upper jaw and the lower jaw together in terms of eating. Tremendous complications. So majority of the patients with a gummy smile are trying to avoid that. And so many years ago, like about I think 10, 15 years ago, that was bothering me too. I was trying to come up with a concept to develop a technique to minimize the gummy smile. That's the reason I introduced the concept of lip lowering or lip repositioning. By just bringing the lip down slightly, it would minimize the display of the gum tissue and create much better appearance for the upper lip.
Now, with the procedure lip lowering, is there any discomfort there? Is there downtime? And how long does it take?
Yeah, basically there's no major discomfort. The procedure will be done under local anesthesia. All my patients coming from around the world, I see them on the day before, like on Thursday. I do the treatment on Friday, and they usually can leave the same weekend, Saturday or Sunday. The treatment will be done under local anesthesia. The length of treatment, depending on the complexity of the case, usually takes about maybe 1 hour, maximum hour and a half. And if I have stitches, I use dissolvable or resorbable. Automatically they get dissolved and disappear. At the beginning, they may feel a little bit tightness of the upper lip for maybe 3-4 days, and then gradually will loosen up. And there is absolutely no changes whatsoever, because one of the common questions they usually ask me, any negative impact as far as appearance, or the lip looks exactly the same, the face exactly the same, there's no negative. In fact, the effect is positive, because if you see the cases that I have done, always the appearance of the upper lip looks much fuller, looks much nicer. So there is no negative impact whatsoever. And people love it.
So is it safe to say if I have this procedure on a Friday, I could be back to work, say, on Monday?
Absolutely. That's all the patients. I see them like on Thursday for consultation. I do the treatment on Friday, and they get back to work on Monday. No really major discomfort or downtime.
Now, doctor, I've been checking out your website, and I see that you actually have emails from, look, there's a lady in Ireland here, and we have Australia, Canada, England, just saying, reiterating how that this procedure has been life-changing, to a point where they went out of their way to send you follow-up emails saying thank you so much for changing their life. That's got to feel great.
It's I get at least maybe 3 or 4 emails from the patients who have had a treatment either for gum discoloration or for gummy smile. In fact, the one that you're referring to, I think the lady from Ireland,
Yeah.
it changed her life, and she could not believe it. It might be a minor issue, but has a tremendous impact, because keep in mind, the majority of the cases, because of a psychological component, it will affect your self-esteem, will affect your self-confidence, will affect your life.
Right.
So it's not a matter of showing more gum tissue or discolored gum tissue. The impact is incredible. When you try to hide your emotion, either holding your hand in front or retraining the muscles, always you're afraid that I should not laugh, or it's amazing that so that's a common comments. I get all the patients coming to me for the treatment.
They say the impact is absolutely amazing. I see you have some before and after photos. If you'd like to show us a little of that impact, I'm very excited to see this.
Again, this is another kind of magic. She's from New York. see the degree of display of the gum tissue, tremendous amount of a gummy smile, but in addition you can see the asymmetry of the lip. This corner is higher than this corner. In this case what I did was just by lowering the lip and a slight reshaping the upper front, and a tremendous difference. In fact, you can see the close-up, the same lady, the teeth, you can see the amount of the gum tissue showing that it is tremendous. I had another case, she's from Chicago. You can see her smile that what she had before, and this is after. In her case, the gum line was not level. Some of them were lower, some of them were higher. In addition, she had some bony ledges, and when she was smiling, the lip was going too far up. What I did this case is just brought the lip down, just slightly reshaping the gum line as well, and looks beautiful. In fact, this is the close-up of her teeth. You can see, if you pay attention how crooked the teeth, the level of cutting edge, the gum line here is lower than here. And what I've done in this case, bring the lip down, lip lowering, I reshape the cutting edge, as you can see here, and reshape the gum line. So this is, in order to have an attractive smile, that's the reason I say when I introduced the concept of the total smile about 15 years ago, we are addressing 3 issues. You have to have a beautiful teeth, you have to have pleasant looking gum tissue, and appealing lips. So when these 3 elements join together in harmony, will form a beautiful and attractive smile.
If you want to improve your smile, call today and have a one-on-one consultation with Dr. Farnoosh. I'm Amanda Latona, and you've been watching Pure Health News.